One of the take-home lessons that we think is important is not just to be cautious in starting drugs and thinking the potential of risks and benefits in general, but particularly to have this awareness when it comes to new drugs. Of course, pharmaceutical companies are eager to sell new drugs. That's what you see advertised on TV. They would like us to start using them while they're still under patent, and not so much the older generic drugs, which they may or may not be better than. But we think new drugs should be sort of a particular concern. New drugs are only given to a limited number of patients before the FDA or European marketing approval. Even more than the limited number of patients receiving drugs is a limited spectrum of patients. So older patients are typically not included in the trial. Patients with other conditions, liver disease, or people on other drugs that might be interacting. So sicker patients, more complicated patients, and patients, frankly, who would be at higher risk for drug problems, drug interactions, adverse drug reactions. Another important thing is I'm just not familiar with these new drugs. So the tried and true drugs, I know the dose of hydrochlorothiazide. I know how to escalate it. I know what's the maximum dose limit. I often know what the pill looks like. So if the patient brings it in and maybe they have made an error and mixed up their medicines, put one medicine in a different medicine, confuse it. I'm familiar with the drugs that I use every day. Just generally, the more drugs we're using, especially these new drugs that we're not familiar with, we're really risking being, out of our league in terms of the familiar drugs that we know how to use and dose and recognize problems from. Another problem with patients getting drugs that are newly on the market is there just hasn't been enough time for those side effects to emerge. So the reporting that takes time, again, with greater numbers of patients, greater diversity of patients, just hasn't been there. So I guess I don't want to be the first one on my block to take some of these new medications, and I don't want my patients to be the first ones to be exposed to it.